Michael was just an awesome human being. He had a heart of gold and just really wanted to do the right thing in life.
Michael Mulcahy was always proud of his Milton roots. He enjoyed a good career as a union plumber, had lots of friends, a loving family, and some personal demons.
I knew that Michael was drinking and, and then when unfortunately it took the turn that he got into drugs, that was something that I was aware of too.
And then he followed this path, which seems to be the path a lot of people follow, where, he couldn't afford the pills anymore. And so I guess whoever your connection is says, well, just try this instead. But it was hard to talk to him about this stuff without making him feel worse about himself. And then you feel weak because you can't get him to stop.
I wanted for him to beat this so badly, so it was really sad to see him relapse and to see the power of this addiction and what it did.
Mike died from an overdose. The call came on December 1st, 2016.
There were many times my brother ended up in an emergency room. Places like BID-Milton are really stepping up to the plate and saying, you know what, this is really important and we're going to do something about this and really make an impact in the community. The work that the hospital is doing is just phenomenal.
We could spend a lot of time, talking about the societal problems, but what we decided internally at BID-Milton was there was a piece we could take on. We needed to augment what we had because we were functioning to a certain degree as an inpatient psychiatric team, and yet we weren't. And we saw this opportunity with Aspire. We could build on what we already had and embed the skills of their clinicians in our emergency department alongside our providers.
Aspire, formerly South Shore Mental Health, has partnered with the hospital for the last 4 years, and the program already recognized as best practice statewide.
Currently, our behavioral health clinician is Brian Comier. He's a licensed mental health worker, and having that embedded clinician means that they are readily available for consultations, for psych evaluations, for behavioral health evaluations on the spot.
What we want is to make sure behavioral health, mental health, addiction, substance use is treated just like heart attack, diabetes, any other problem. And if we do that, we know we're going to do a great job. One piece that we're adding now are these recovery coaches, and they're people from the community who've been through the same thing and can help with the many steps that need to be taken in the future. One more exciting thing that we're going to start very soon that we've been preparing is the prescribing of Suboxone directly from the emergency department. We want to be able to start Suboxone that night here in the ED and then continue it on with the recovery coaches, with outpatient coordination, with team members that support us.
Medication-assisted therapy using Suboxone reduces withdrawal symptoms, allowing patients to be weaned off opioids without severe side effects.
By offering them medication-assisted therapy in the emergency room, this offers them an opportunity to use Suboxone instead of fentanyl that one day and gives them an opportunity to live an extra day and get into care. When you get a patient with substance use disorder in and you start treating them with medications and they get better, it's pretty incredible to be able to watch that.
The Mulcahy family has done more than just watch the progress being made with substance abuse treatments. They have joined the effort to raise awareness and funds by organizing Mike's 5K to crush substance abuse.
It's a day that just feels good. It feels great because you have all these people coming together and we're doing something positive.
Proceeds from the run support the Milton Substance Abuse Prevention Coalition programming in the Milton Public Schools. Programming that began at the high school level and now extends to the elementary school thanks to funding from BID-Milton.
We are in the business for educating the students, but not just in math, science, English, or history, or world language, but we have to educate them in making better decisions throughout life. The support that we get from BID-Milton runs the gamut. Most recently, they supplied the elementary school a health curriculum at the 5th grade level.
It's how you deal with it, it's how you cope with it.
I think if you can make that connection really early, I think it can make a huge difference. If you can get the kind of help that you need, then that can save a person's life, no question about it.